Hello, everyone, and welcome to our latest edition of Seniors Views. Tonight's topic is healthcare, then and now. And when I read about all of the contributions to Windsor and Essex County by our guest, Dave Cooke, it makes me wonder what I've done with most of my life so far. Dave was born and raised in Windsor. He graduated from the University of Windsor with a degree in social work. He then went to work at the Children's Aid Society. He was a member of the Windsor Planning Board and was elected as a trustee for the Windsor Board of Education for a couple of years. Then when Windsor Riverside MPP Fred Burr retired, Dave was chosen by the NDP to run as his replacement in 1977. He was elected Windsor Riverside MPP that year. That launched a nearly 20-year career at Queen's Park. And beginning in 1990, when the NDP formed a majority government under the leadership of Bob Ray, Dave served in a number of cabinet posts, including Minister of Housing and Municipal Affairs and Minister of Education. He was also instrumental in bringing the casino to Windsor. After he retired from Queen's Park in 1997, he was appointed to several high-profile education jobs with both conservative and liberal governments that followed the Ray government. He has also served on a number of local boards and committees, including as chair of the University of Windsor board and chair of the local health improvement network, as well as co-chair and Program and Services Steering Committee for the new WindsorEssex hospital system. So it's my honor to welcome Dave Cooke tonight. Hi, Dave.
Hi, Rob. Thanks for inviting me.
Thanks for being here. It's a real pleasure for me. I covered you. I was at your nomination meeting in 1977 when Fred Burr introduced you. So it's been a long time. So let's start with since we're talking about healthcare then and now, we can talk about politics later if we've got time. But so let's start with the way hospitals were in Windsor and Essex County when you entered Ontario politics in 1977.
Well, I mean, here locally, we had 4 general hospitals, and then we had the chronic care hospital at Riverview. And each of the 4 hospitals, Windsor Western, Grace, Hotel Dieu, and Met, were considered, I guess, general hospitals, which meant they did a little bit of everything, which is quite different than the way things are now. So they were, if you remember Grace on University Avenue, it was a pretty small hospital. I think Windsor Western at one point before it was a general hospital was a sanatorium.
For tuberculosis.
Yeah. So that was sort of the structure of our hospital system back then. And there was, people came to the conclusion, well, the government itself, when I was elected in 77, Frank Miller was the Minister of Health, and the government of the day, the Davis government, had come to the conclusion that we really needed to restructure our hospital system. So that resulted in one thing happening in Windsor. Riverview, which was a old building, was closed with a promise that it would a new chronic care hospital would be rebuilt, which incidentally didn't happen until 1995. So nearly 20 years later. My grandmother was actually in Riverview for a while. Anybody that is old enough to remember a grandparent or somebody being in that old Riverview hospital, from everything that I recall, of course, care was fine, but the definition of a ward room back then was, there could be 6 or 7 beds in a room. It was really, really old style hospital that I think in retrospect, the government was correct to close it down, but was incorrect in not providing an alternative to our community in a rapid way. Then came the point in time when it appeared I think, to everybody that things were changing in the healthcare system. Having these general hospitals do a little bit of everything didn't necessarily provide the quality of care that you really needed. You needed to have specialties where a hospital was maybe doing cardiac care, a hospital might be doing orthopedics, a hospital may be doing all of the birthing and infant care, so that they really became specialists in those fields. The doctors did a lot of those kinds of cases, so they became very, very expert in those fields. But we couldn't have 4 hospitals and continue to do it that way because we're a relatively small community. So you needed to look at how could we have those specialists and those programs sort of focused in a couple of facilities, which ultimately led to, during the Peterson years, restructuring. Remember, back in the old days, we had a thing called the Health Council,
Right.
which was supposed to do planning of healthcare, but it had no power.
Yeah,
So it could write all this.
usually I remember covering, I went to, for about 7 years, I went to every health council meeting, and Charlie Clark was then the chair of the thing. And what I remember, I'm sorry to interrupt, but
No,
what I
no.
remember is the province would call the health council and would say, send us a proposal for X renovations at Metropolitan Hospital, for example. So when you say the province actually had the power, not the health council, you're right, because they would suggest things to the health council. And then I remember those meetings, the health council said, well, the province tells us we need this, so we should send a proposal for that.
Well, and they would do, the Health Council wrote many, many reports that they initiated themselves that essentially went nowhere because they weren't the decision makers. So, and at that time, we had regional offices for the Ministry of Health. So the regional office was in London for our region. So it was, there wasn't a lot of local control, for one thing, or a lot of local decision making. But the Peterson government made a decision that we needed to take a look at communities like ours and look at the hospital systems and see what restructuring would look like. And probably Charlie Clark was still involved in that, but then Mary Jean Gallagher also came in, and she ultimately chaired the committee, and they were working away and making some progress with the understanding that we were not, at the end of the day, we were not going to continue to have 4 hospitals. And it was a matter of which ones were going to continue and which ones weren't. And Mary Jean continued in that role when my party formed a government, and ultimately the report came back. It was an interesting process because the Catholic community and the Salvation Army community wanted to make sure that one of the hospitals remained a religious hospital. And there were lots of other people that felt that time had come that we didn't need to have religious hospitals. We needed to have all public hospitals. At the end of the day, Grace and Hotel Dieu melded together and formed Hotel Dieu Grace, which was downtown, and became Met, and Windsor Western became part of Met. And we had the 2 hospitals, and Windsor Western became the post-acute, so rehab and chronic care and a number of things like that, but not acute care and no emergency services. And that's where we were in the that didn't come to full fruition until the Harris government was in power. We had been working with them. We'd pretty much come to the conclusion, but it was implemented under the Harris government. And that's when people might remember The new emergency and entrance to Hotel Dieu was built downtown. There were some changes to Met, and that was sort of the compromise. We didn't ask for a new hospital. We took the two older hospitals and did a little bit of renovations, which in retrospect was probably a big mistake, because other communities, when Harris came in and did the major hospital restructuring, the communities that had hospital closures ended up getting brand new hospitals built, which, as an aside, has made those of us that are working on the new hospital now try to remind the Ministry of Health that our community was the first community to restructure on our own. It didn't have to be implemented, and we basically let the government off the hook and didn't have a new hospital.
Right. So you mentioned that it was probably a mistake. Why is that? Just because we could have gotten a new hospital then?
I think it was time already where we could have, back in the 90s, be moving to a single site acute care hospital with expertise in, the way things are now and the way things were then when the two hospitals were created, or from 4 to 2. We end up having doctors that are having to go from site to site. We have some cardiac care beds at Met. We have the cardiac center at the downtown campus. We have some orthopedics in both hospitals. It's just not efficient. If you talk to some of the specialists that are on call on some weekends, they will tell you, that the last weekend that I worked, I was back and forth between the two hospitals. I worked 35 hours in a row, had to drive myself back and forth. The number of patients that are shipped back and forth, because not everybody comes into a hospital with one problem. Usually, if it's an elderly person, they usually have a couple of problems. And, I can go back to one of the times that my mom was in the hospital and she had both lung and heart issues. So her lung issue was being treated at Met. Her heart issue was being handled at the downtown campus, and she was being shipped back and forth, which is not good for patients.
And the thing that I know I covered it as a reporter, but what I can't recall is when after Grace and Hotel Dieu joined together, the Grace site was used less and less until it became what ultimately was this abandoned hulk on Karen Avenue or Crawford Avenue. How did that happen? How did I'm sorry, that it just suddenly wasn't a hospital anymore? It was more of a community center for some medical programs.
Well, I guess the decision when the two hospitals were coming together was that Grace was going to close. It was a small hospital. There was no rationale for keeping that small hospital open. It had to be closed, so it eventually became essentially boarded up until there was an idea, which I never thought was a good idea, of turning it into a long-term care home. Trying to take an old facility filled with asbestos and turn it into a long-term care home doesn't serve anybody well, including the residents that would have ultimately lived in there. So the best thing happened, and that was ultimately it was torn down.
Right. What during that controversy, what you saw no reason to restore it? Is that what
it's too expensive, and you end up, if you try to restore an old building, you never get it up to the standards that we have today, which is the same argument for the existing facilities we have. There's some people that are arguing, well, the downtown campus could be restored into a a brand new into a new hospital. Well, I mean, if you walk through the downtown campus, the rooms are small, the hallways are narrow, and you can't. You first of all, it would cost a mint to try to restore that building, and secondly, you still would not have a modern state-of-the-art hospital. You'd have an old hospital that's been fixed up.
And it's pretty well the same for Met. Like, people forget the original Met, when it was the new hospital in 1920, around then, it was that location was the edge of town in 1920, and people were against building in a farmer's field. Does that sound familiar? and you know, to try to, there are signs up on front lawns all over our neighborhood here in Riverside that say, you know, keep Met and the former Hotel Dieu downtown campus. What do you think when you see those signs?
Well, I wouldn't. I mean, we didn't have that many in Riverside. There were other places where there were a few more, but it's just not practical. I mean, we have a certain number of cardiologists. We have a certain number of lung specialists. You know, we are not Toronto. So if we're looking at trying to have a center where we have our specialists that are providing excellent care, we can't have them divided up between 2 or 3 hospitals. We got to give them state-of-the-art facilities, and we've got to have them at, I mean, we went through, you will probably remember, it'll be 10 years next year that Dwight Duncan appointed Tom Porter, Teresa Peruzzo, and myself as a task force to consult the community about whether we should move to one new state-of-the-art hospital. It was overwhelmingly, our consultation showed overwhelming support for moving in that direction. So that's going to be 10 years next March. Wow. That process started. So, and even the doctors, of course, the doctors that we consulted with said, you know, we need state-of-the-art facilities when we do get the new hospital. And we already saw a bit of this when doctors knew that we were moving in this direction. It's gonna be in itself an attraction to more specialists wanting to come to Windsor, because if they can work in state-of-the-art facilities, that's a real attraction to them.
And that's a point I don't think the general public is aware that, even though we're talking about a so-called mega hospital for Windsor and Essex County, it's also intended for a wider area, is it not?
Yeah, I mean, there was actually, was it a car accident or something that was in the news today or yesterday that was in Kent County, and the individual was taken to Windsor Hospital because we are the center for that type of service that is required. We'll be able to do more of that and have easier access for both Kent and some of Lambton County when we're on 42, because you'll be able to come right in either 401 or the 22 and the expressway, and have access. Now, some people would say, well, who cares? The reason we care is because we don't do open heart surgery, for example, in Windsor. And it's not because we don't want to, it's because that type of service and other services are only, the government only allows you to do that when you have enough cases that the doctors that are doing the service do quite a few every year, and they develop the expertise. You wouldn't want, and I wouldn't want, to have open heart surgery by a cardiologist that only does 3 or 4 a year. We want somebody that's doing them, you know, several a week, because then, so that's, as we open up the access to our new hospital for cardiac care, for example, to Kent County and to Lambton County, then we're going to get more cases in and we're going to be able to offer more services because we'll have the demand of those cases.
So we could probably expect, and this is sort of a little off the topic, but it's still healthcare. COVID, we've taken in cases from Toronto and other places. In this way, we would have the expertise for other things, like you said, like heart surgery, that type of thing.
Yeah, I mean, we've already developed, as you know, when we started doing heart stents, initially we were only doing not easy cases, but less challenging cases. Windsor has developed into very expert services, and we do a lot of these cases, and we do complicated stent heart procedures as well. So we've developed the expertise and we have the numbers, and we've got cardiologists that are spectacular at providing that service. We don't have to ship people to London or to Toronto for that service anymore.
Right. And
although I will say, just to reinforce how old our facilities are, you'll remember just a few months ago in the summer when we had 2 major rainstorms, our cardiac stent program, which is in the basement of the downtown campus, flooded, and we had to start sending people over to Detroit and to London because the program had to be shut down for a few weeks because of the flood.
Do you think, I mentioned COVID, do you think COVID has, it sort of supports the argument for a mega hospital? Like, how do you think things could be different for a pandemic if we had a specialized
anybody that goes into the hospital now, and I haven't gone in to inspect the rooms, but I know I've been told what they're like, and I know somebody that's gone to visit, and you will see that in many of the rooms, the beds are divided by a tarp in order to protect people from any germs or anything that might potentially be COVID. You'll see, where we used to have, well, it's still there now, but the COVID test center downtown, the hallway where you lined up was divided by a tarp. We have only 20% of our rooms are private rooms. Then we have some that are semi-private, and then we have ward rooms. Now, the ward rooms and the semi-private rooms have the same people going and using the same bathroom. And in many of the cases, the toilet is in one room, and then you have to walk out of the room where the toilet is and then go to the sink. And there's several people using that. In the new hospital, thank God, the state-of-the-art hospitals now are virtually all private rooms, so that everybody, as David Mushi says, one bum per toilet.
Right. What about the people who are worried about private rooms and whether they will be able to afford it? Is this something to be worked out in the future with OHIP and insurance companies?
It would be the same situation as it is now, that if you go to the hospital now and you've got a very communicable disease, they're going to, assuming there's a room available, they're going to put you in a private room, whether you've got coverage or not. And you don't get charged for a private room when you're put into a private room. So no, of course not. We couldn't possibly be able to say to people that there is no ward room, so we got to charge you privately. People don't, I mean, even the guys that work in the auto plants now don't have coverage for private rooms or semi-private rooms.
The Premier if you're reviewing this later, this is October 18th, but today the premier made news here in town. You were there. Tell us what he said.
Well, I mean, you remember that in the budget for the province earlier this year, the new Windsor Hospital was mentioned in the budget that they would be moving us to stage 2, and it was reiterated in the throne speech a few weeks ago. So the premier came into town today, and we had an event where he and the Minister of Health, Minister Elliott, who's also the deputy premier, restated the commitment, and the letters have now been received, and we're now officially in stage 2 planning for the new hospital, and we've received where we've been committed the new funding for the cost to do the stage 2 planning.
Has the Ford government generally supported this project in your estimation? You've been on the inside for quite a while.
Well, it took a while, only because when they came into office, like any brand new government that would come in, everything was on hold as everything was being reviewed. The previous government, the Liberal government, Minister Hodgkins had come into town in December of 2017, and we had a big event for him at the downtown campus, and he said, we're putting you into stage 2, but we never received the funding. So we never officially got put into stage 2 by the previous government. So the current government was faced with us still being in stage 1 because the Liberals had not delivered. So they reviewed it. You'll remember the premier came into Windsor last year, I guess it was, and
Right.
met with all the mayors and the warden, and all of the mayors, including the mayor from Chatham-Kent, indicated that the #1 priority for our region is a new acute care hospital. And the premier said, if that's your #1 priority, then I'm going to fight for this to get done.
And I heard a number today, was it 9.8 million?
9.8 million for the stage 2, yeah.
Yeah, and what does stage 2 entail?
Stage 2 will get fund obviously consultants, and that's the experts that help us, but a deep dive into everything from the number of beds to programs to the size of the hospital, and all of that stuff, so that at the end of stage 2, we're in a position to be able to give that information to stage 3, where architects then begin to work on actually designing the hospital.
So what kind of a timeline are we looking at? Is it 5 years, 10 years?
Well, I know David has said that he would like to get through stage 2 by the end of 2022 or early in 2023. And then we would turn that into the government. And then obviously part of that is what the turnaround time is with the government, but it should move on to the point where we should be looking at hopefully turning sod in just a very few years. I can't give you an exact time. That's something that David Mushi would be much more expertise at than I would, but
Yeah,
but we're not talking decades anymore. We're talking years.
right. What is there something you could tell our viewers on this sort of narrowcast? Is there something about this hospital that stands out even in the early planning now that we've never seen before? What something that will revolutionize healthcare in this area?
I suspect it'll be, we did a town hall a few years ago with the CEO at the time of the hospital, Humber River, that you see when you're driving along 401 in the north end of Toronto on the north side of the 401. and it's just been open for a few years, and it's very high tech. So, everything from medications that go to your room are delivered electronically. Um, uh, each room, as I said before, is a single room. There's a space between the room and the hallway where all of your stuff for your care is provided, is stored separately so that it's safe, and it's prevents infection and that type of thing. It also has things so that when a nurse walks into your room or a doctor walks in your room and you've got your TV, as soon as that person walks in the room, their name and their job appears on the TV.
Oh, wow.
If a doctor or a nurse is in your room and is discussing your case, they'll call up your case on the TV. So if you had a CAT scan, they can call your CAT scan up on the TV and go over your CAT scan with you. There's all of that. Oh, the other neat thing is in the private rooms, and again, virtually all of them, and who knows, this hospital might be all private rooms. It's there's a little L shape in the room, and there's a bed in the other part of the room, or a chair that goes down into a bed, so that if a family member needs to stay overnight, the family member can sleep in the room. There'll be access to plug in your computer. So it is really patient-centered. It's really modern, and it's safe.
And I've noticed, fortunately, I haven't spent much time in the hospital over the past few years, but the people, the new physicians we're getting, some of them from the Windsor campus of the Schulich School of Medicine and Dentistry, it seems to be a new attitude as well. They're better communicators. I can't help thinking that's got to be part of the plan too.
Well, if you remember in the old days when we were kids, and I was lucky, we had a very, very good family doctor. But my family doctor back then is the same one that delivered me, the same one that removed my tonsils. Family doctors don't do that anymore. And they all wore suits. They were all men. Yeah. And it's different now. I mean, doctors, you don't call them doctor or whatever their last name is. You usually, I'd see a specialist at this point for nothing particularly serious, but did a phone meeting with him the other day, and he calls up and he says, hi, it's and just used his first name. You just wouldn't, it's different. The relationship between the doctor and a patient now is still very professional, but a little more patient friendly.
Okay, we've got a couple of questions from the audience here, David. So I'm looking at this, I'm reading this to you for the first time. So what are they going to do with the old buildings is the first question.
Well, the downtown site is still going to have, and this was part of the compromise, still going to have, we always intended to have services downtown, but we're going to be using the old downtown site for some day surgeries and for the urgent care. And I hesitate to use the word urgent care because the urgent care facility, there's no beds associated with it, is just like an emergency room. It's going to be staffed by emergency doctors, staffed by emergency nurses. It's going to have a CT scan. It's going to have its own lab. So it's going to be able to do everything that an emergency does. And that'll be downtown, and day surgery. And we'll have some day programs too, that preventative programs and so forth. So there'll be lot of services downtown. There'll be a large part of the downtown site that won't be used. So we're going to have to figure that out with Hotel Dieu, because it's actually the Catholic, I forget the exact name, but the Catholic corporation that actually owns the site. The Met site will be demolished, and the property would then be redeveloped. I can't really say what, but it would, in all likelihood, knowing South Walkerville, you've got a strip of land along Tecumseh Road, and you've got all the very nice housing in South Walkerville. So you'll probably see it move to residential and some commercial.
And in the West End, what now
That
is
remains the same.
that remains
The neat part of the project that people don't really they only focus on the acute care hospital, but the one of the very progressive parts of the project is that acute mental health, which is at the acute care hospital, and it's 60 or 65 beds, is going to be relocated at Hotel Dieu Grace, which has post-acute care mental health and outpatient mental health. And they also have a working relationship with WindsorEssex Mental Health Association. So the acute mental health is going to be moved there. And we're going to have a mental health center of excellence for our community, which is going to be fantastic to have moved mental health that far ahead in our community.
This is more of a comment, I think. Somebody has written, I like that there will be one, I don't know if he or she meant faculty or facility for all services. Is that pretty clear?
Yeah, that's the point of going to one acute care. So all of the acute care will be at the one facility. I should point out, when you were reading it and trying to figure out whether it's a faculty or facility, that reminds me that one of the motivators for the new facility was that a number of years ago, when Schulich Western University Medical School, located here, one of the deficiencies that we've got is that there's not a lot of space in the acute care hospitals for teaching and research. And that's all being built into the new facility, so that there'll be teaching, and there'll also be proper research facilities in the hospital for our research that's done. So the people that do research at the university will also have facilities at the hospital.
That's great news. Anything else you want to add to the mega hospital? Is there anything we haven't covered?
Well, I guess the only thing I'd say is that we still do have a long ways to go. So we need people in the community to continue with the encouraging government to move forward as quickly as possible, and encouraging our local politicians to continue to be supportive. We're going to have a provincial election next year, so I would hope that voters would take a look and see what the parties are saying. We now know where Doug Ford stands. We want to see where everybody else stands, and make sure that we elect people that are going to be supportive, and a government that's going to be supportive of this hospital.
Okay. I don't think we can talk about healthcare without talking about long-term care, which has been, I don't know how to put it, probably exposed by COVID, the flaws in it and what needs to be changed. How do you view it? I know this is personal for you as well.
Well, I mean, I think there's, again, if we looked back at the way things were and the way they are now, I would say not a lot has changed. We might have a few facilities that are newer, although we still have facilities like Banwell and the one downtown that are still, are very old. I mean, they don't even have air conditioning in the residence rooms. So we've not made a lot of progress in that way. We still have, in my view, a problem with for-profit facilities that, we just wouldn't stand for with kids if we were, we wouldn't have a children's mental health facility that is run by a private for-profit company. So why do we allow that to happen with seniors? But I think there's also something even more fundamental, and that is, why do we institutionalize our seniors? Why do we have to have a place that has 250 or 300 beds in it? As long as you have a big institution, you're going to have problems. It's going to be bureaucratic. It's not going to be patient-centered, and it's not going to be a home. You can label it the Long-Term Care Home Act, but anybody that's been in any of the facilities knows it's not a home at all. It's a big institution where a lot of people are, lined up in front of a TV. It's just, we need to look at alternatives like they do in Denmark and other countries where we have small group homes, where we have much better home care programs in the other countries where people ultimately have more choices. But here, you basically, especially if it involves dementia, you basically have no alternative when your loved one gets to a point where you can't take care of them at home.
Yeah, because they need 24-hour nursing care at least, and a doctor on call.
Yeah, I mean, the doctor thing is there, but you need, it's really, most of the care is provided by PSWs and by family.
Well, at a couple of points in your political career, you were the health critic. Did this come up during your years at Queen's Park?
I say without hesitation that I asked more questions about nursing homes in my 20 years than any other member of the legislature. And I know that to be a fact. Worked very closely with some organizations and with NDP research, and raised questions about nursing homes and issues in nursing homes regularly. Got some amendments to the act when the Liberals were in power under David Peterson and Murray Elston was the Minister of Health. Worked with him and got some amendments to the Nursing Home Act back then that I was able to move. But yeah, it was a big issue, and I just feel that we haven't made much progress.
They strike me as being like warehouses.
Exactly. That's what they are. They warehouse, when you've got 250 people in an institution, that's what happens. And during COVID, it was particularly sad because they were isolated in their rooms. The family couldn't visit them, and they were kept in their rooms by themselves for almost a year.
So is the solution government-owned long-term care? Is that the solution?
I wouldn't want the government to own them, but I wouldn't mind seeing conversion to non-for-profit. So more either more municipal homes being one option and nonprofit groups running them. But I'd also like to see a plan where we provide alternatives. And the dream would be 50 years from now that we would say the only time that long-term care homes are used are for the very, very far advanced residents that even wouldn't do well in even in a group home. But that, I see at my dad's place, there's a large number of the residents there that would do very well in a group home. Some would even do fine on their own with better home care.
Right. And as a result of COVID, I keep hearing that we have a shortage in those areas like uh, home care, fewer nurses, or, they're kind of burnt out. And uh, so what's the solution? I'm not asking for a magic, bullet, but what do you see as the future of healthcare to get this on the right footing?
Well, I mean, I don't have all the answers for sure, but I do think we've got to beef up home care, and we've got to, instead of, I mean, I had my parents living with me for a while. My dad was with me for 3 years, and my mom the first year until she passed away. And at one point, I had 5 different agencies under CCAC, which is now the LIN, coming in to take care of my mom, and I had to manage. Somebody was supposed to be coming in at 1 o'clock. If they weren't there by 1:45, I'd have to be on the phone. Where are you? If the nurse was going to be coming in and didn't know what time of the day they were, I had to manage all of that. I don't know how a senior on their own or an older couple on their own would be able to manage it. So we need a better form of home care so that it's user friendly and can provide better services. So that's part of it. And then these group homes and alternatives, I think, are important as well. We got to figure something out pretty soon, because you and I are, and along with hundreds and hundreds and hundreds of thousands of others, are getting older.
That's right. And like you, a lot of us are dealing with parents now who are dealing with dementia. You mentioned dementia, physical disabilities. A fall at 40 isn't as bad as a fall at like 85. You could die.
Yeah.
Another thing, this is something that I was just made aware of, speaking on dementia, that there's a recent study about loss of hearing that they've tested some patients. While if they get them hearing aids, they can stave off dementia a little bit, like you can live longer as a result. But I'm told hearing aids, if you don't have insurance, are incredibly expensive these days.
Yeah, it's one thing that my dad was lucky with, because he had good benefits from where he worked. But you're right, hearing aids now, I mean, the government picks up through the assisted devices program. Is it 2/3 or 3/4 of the cost? But that still leaves a sizable chunk of money that if you don't have some money set aside or a decent pension, it's hard to come by.
Yeah. What do you foresee? I think most of the legal challenges to the mega hospital have kind of ended, have they not? It should.
I think the camp people were on the news a few months ago saying that they weren't going to pursue anything more in the courts. They were saying that, there were elections happening municipally, so maybe they would try to get a new municipal council to reverse the zoning, which they can't do. So I mean, I've got to stay focused, and so do all the
Right.
people at the hospital, focused on where we're going. And today, with the announcement and reconfirmed by the Minister of Health and by the Premier, It's all good news, and it's just now carry on and let's get this done.
Is there, with, nothing good comes without a certain amount of barriers that you have to overcome. I'm sure in your career you've overcome a lot of barriers. You were in the the non-government benches for a long time before you got a shot at government. In keeping the focus on healthcare, even though we don't have all the answers, we haven't done everything right. Is there any silver lining to any of this? Is it that to prevent this in the future, maybe? Like, I'm thinking the pandemic, I'm thinking long-term care, how we're altering our health system.
Well, I mean, I'm optimistic about getting a new hospital, but all the other problems facing healthcare, it's a real challenge, because the cost of healthcare as a percentage of our provincial budget is huge. It does not look like that's going to decline. And nobody wants to talk about raising taxes. And we should be more honest with people and tell them, if we're going to provide better services, we're going to have to pay for them. And the only way to pay for them is to collect revenues through taxation. I think there are some good stuff with technology, which is helping a lot. And you've got to think, we were talking about then and now, think about somebody that had some types of cancer at the beginning of the 70s, had heart disease. Back then, we didn't even have, at the beginning of the 70s, I'm not sure we even had bypass surgery. It certainly wasn't a regular thing. That was later. Stents, which have really taken over from bypass in a great way, much less expensive. People are in one day and out the next day.
Organ transplants.
Yeah. But I mean, the technology is helping a lot, and drugs, again, with heart disease. Look at the drugs that are there now that I don't think my mother would have ever lived to age 89 if it wasn't for some of the miracle drugs dealing with heart. So I think those are all positive. On the negative side, it's costly, and the demand, and we've got to do something about wait times at emergency rooms and things like that, where people are frightened to death of having to go to emergency because you can be there for hours and hours waiting.
And are we producing enough doctors and nurses to keep up with the demand?
I don't know the answer to that. I think we're producing enough doctors, whether they're being distributed in the right places might be another question. Although, again, even in our community, we're in much better shape with specialists than we were 30 years ago. We're still real short when it comes to psychiatrists, but we're in better shape than we were. So, some of that has got some good news too. The medical schools have helped a lot.
Yes.
The new ones.
Well, Dave, I think we're running out of time rapidly, but I want to thank you for being here tonight. It's been quite, I don't use this word often, illuminating, because you're sort of an insider like you are an insider. And I just talking to you briefly the other day, I learned some things, and I'm pretty nosy as a former reporter, but you're a font of information. We might have to have you on again for a different topic, maybe after the provincial election. But thank you for being here.
Thanks,
You're
Rob.
I really appreciate it. It's a real honor. Your service has been exemplary in this thing, and I want to give you a shout out for the Faro Riverside Miracle Field, the work you did on that, the fundraising, etc. Because that place is going to be booked, practically every day for.
It's a spectacular park.
Yes, and you know, disabled children deserve that kind of facility as well. So thank you for being here. For our audience, one of your colleagues from one of your jobs now is on the Essex Housing Committee. And one of your colleagues on that committee, Mark Morris, is our guest next week, next Monday, to talk about how technology has changed, something that we've been talking about, but he's spent his career with Kelcom and Security One. So he'll be talking about those old brick cell phones we got back in the in the 80s. But anyway, thank you for being here tonight. I really appreciate it. And this will be online after tonight, so you're going to live forever on the internet.
Okay. Thanks, Rob.
Thanks again, Dave.
Take care.
Bye-bye.